Good morning, everybody. It's Mark Perlmutter here. You're shooting another instructional video on how to do a classic knee injection. There's other ways of inject it that I'll put into another video, but this lovely volunteer is only having one injection today, so we'll show the classic way of providing a knee injection. She has what's called a valgus knee, which means that her bones angle to the outside, and so the outside of her knee space is narrower than the inside, and she's got some arthritis on the outside. So I prefer to go on the other side of the joint. It's wider over here and crushed down a little bit narrower on the inside, so it's going to be harder to stick a needle in that side, and what's harder for me is harder for her, and the whole goal is to lower discomfort through this process. Who likes a shot? Nobody. So we can easily palpate this junction between the bottom of the femur bone and the top of the tibia bone, and there's a little sweet spot right next to the tendon. So there's the patella tendon, here's the patella, here's where it attaches at the tubercle, and you can run your fingernail right on the edge of the tendon and move the knee easily. And so I mark the spot below the femur with my fingernail, above the tibia, and just to the border of the patella tendon, and you can see where I found it before this, and there's a circle that I make with the end of this, and that allows me to use chlorhexidine or alcohol or both. We're using just alcohol right now. I pre-cleaned it before we started shooting, and then I let it air dry. I'll typically get a Band-Aid and open it then. I pre-opened this for the sake of making a shorter video, and the position of the needle is important to understand. It's absolutely perfectly parallel to the floor and run at 45 degrees. It goes in at 45 degrees and easily right into the joint. If you run into anything, just reposition and a nice slow injection. I'm using betamethasone here, 12 milligrams. I have my alcohol pad always ready. I hold pressure on it a little bit, and the Band-Aid is always ready to go. Nothing's more embarrassing or to the doctor or the provider or irritating to the patient than to have a drop of blood drip down their leg, which you'll see if people are on aspirin or something like that, of course. Band-Aid's good to go, a little bit of pressure, no spotting through, and that's it, simple as can be. I use Kenalog or betamethasone, and I use a maximum dose of 12 milligrams or so for a betamethasone and 40 milligrams of Kenalog, typically cut in half if they're diabetic. Thank you very much.